Hi, Dr. Jon Baker, New Beginnings. This is going out to all my clients, so I'm sure each and every one of you know who I am. But I also introduced myself because if you have an urge to send this video out, it's going to be about 35 minutes, so no, it's not something you can just blast out on Instagram or whatever, but it's definitely something you can share if you feel compelled to share it. You know, one of the things that really stood out to me during the lockdown of the pandemic was the gross majority of you at New Beginnings did so amazing it's hard to even explain. When over half the chiropractors in my little resort town were closed down, locked down, shut up for over, right now, 10 and a half weeks. And I'll tell you why. Because each and every one of you knows what you do as a corrective care chiropractor. But I gotta tell you, if I'm a sports chiropractor, if I'm a geriatric chiropractor, meaning not that I'm a geriatric, even though I am, but I mean specializing in taking care of geriatrics, or specializing in taking care of pediatrics, or specializing in knees, or specializing in whatever, I have to tell you, I'm always gonna be a necessity. I'm never gonna be a luxury. And because I'm always going to be a necessity in my industry, which is corrective care chiropractic, I can afford and you can afford so many luxuries that others know nothing about. You know, I'm sure that if you were to match the numbers of all the corrective care doctors at New Beginnings with over 63% of you being right on track or ahead of schedule, 15% of you being way ahead of schedule, and over 11 offices had one of their best months ever in March, April, or May of 2020 during a global pandemic. And the other 25%, whatever's left, you had a tough time, but it wasn't a tough time. You know, you might be down 30%. I think the toughest case I saw was down 53% in collections. But they bounce right back the next month. Think about it. So why are we making this video today? Because the most important thing I can tell you is corrective care for me is not a luxury for human beings. It's a necessity. Corrective care for me is going to take, 50, 100 more years to really lock down its position in chiropractic. And corrective care isn't better than sports care, than geriatric care, than pediatric care, than relief care. It's just something different, but it's not different as in we're so much better. It's different as in we're an add-on, we're another bonus. You look at your car, right? You look at your car. I remember when car windows rolled up. Now you push a button. Well, pretty soon you'll just say, if not already there, driver's side window roll halfway up, and it'll just do it. See? Now that's a luxury, because as long as I got that handle, I can roll up and down my window. But when was the last time you rolled up and down a window? See? I want you to think about that. So the other thing I thought about was, what if we had more than my explanation of corrective care? So I compiled 9, 10, 11 other doctors in New Beginnings to discuss corrective care with you. Now, I'm not interested in what you think I'm saying wrong. I'm interested in what you think we're saying that will help you serve more people, work less hours, make more money, and have more fun. So here, listen to a couple doctors explain their version of corrective care before we move on.
Hey, Dr. Baker, Dr. Gucciardo here. I was thinking about corrective care versus relief care. And when I think about it, I think about relief care. It's part of the puzzle of corrective care, but it's only a small part of that. I think about it sometimes with some of my patients. Sometimes we'll get great results. People get relief right away. But some people, if I'm seeing them for 4 months, 6 months, 8 months, might not start really getting true relief for 2-3 months into there. They'll start to have small little wins that add up. So relief care, to me, it's part of that puzzle. It's a small part, but the whole corrective care is what the true where the true healing takes place. You know, for me, when I first came to New Beginnings and I looked at my PVA numbers, I thought I was a corrective care chiropractor. I believe in wellness. I believe in getting checked regularly for myself, for my family, for my staff, you know, for my patients. And that's the story I thought I was giving. But looking at those PVA numbers, it made me realize that I was just slightly above relief care. So that made me check myself. Now I think about it this way. You know, if I had 3 clogged arteries and I went to the cardiologist and he said, listen, doc, what we're going to do is we're going to correct one of them. We're going to correct one of those arteries. We're going to do that surgery. And then you come back to me when you have chest pain again, or your pressure goes up, or you have a heart attack and you get admitted to the hospital. Like, that wouldn't make any sense to me. And now that I think about it, I don't want to do the same thing to my patients. I don't want them to come in and I tell them, okay, we're going to take care of you for, 8 to 12 to 16 visits. You'll get some relief, and then you'll come back when you're having a problem again. I feel like that's ripping them off, me personally. I feel like if I don't tell them the full truth, that you have 3 clogged arteries, all 3 need to be taken care of today, then I'm lying to them. And then I would have to sleep with myself at night, go to bed at night, wondering, did I do the right thing? So for me, relief care is part of that corrective care, but the whole thing, that rehabilitative with that, going through it, especially knowing that some people need a year to a year and a half to fully get the changes they're looking for and to fully restore to the best of their ability. I can't tell them anything less now. So for me, corrective care is being truthful and honest. And if someone doesn't need corrective care, if they need a small corrective care program, then that's the truth too with that. But I'm realizing now that I've been actually underutilizing the services I give to my patients over the years. And I'm so thankful now because the patients are doing better. They're getting better results. They're hanging in there and trusting because they know I'm not talking about pain anymore. We're talking about function. And that's what corrective care is. It restores function, 100% function back to the individual so they suffer less and have less pain in the future, and they can live vibrant, healthy lives now. So that's my take on corrective care. So thank you for helping me see that so late in my career that I wasn't actually talking the talk. Now I'm actually doing it. So thanks a lot, Dr. Baker. Love you. Take care. Have a great day.
35, 40 years ago, I was in chiropractic college, and my dad had back pain, and I convinced him to go see a chiropractor. And he started seeing a chiropractor locally and got adjusted a few times, and the guy told him, come back when you're hurting. And he did. Well, no, he really didn't. He waited, and it would still bother him. And when it got really bad, then he would go in. And fast forward 3 or 4 years, I'm out of chiropractic college, I'm in practice. He's still seeing the doctor over there on occasion, right? Until about probably 10 years in, when he literally couldn't even walk anymore. At which point in time, I had him come into the office, took some full spine x-rays and evaluated him, and saw just how degenerated his low back was, just how bad the disc was, just how bad the bone spurs were. And I couldn't help but think that was my fault. That was my fault because I didn't follow through with care recommendations. I didn't take care of him. I can't help but think if he didn't see a corrective care chiropractor then, somebody that actually analyzed that spine and took care of them and adjusted them and made sure that that was corrected instead of just trying to get him out of pain, maybe he wouldn't have the degeneration in his spine and his health that he has now. For me, every time a patient walks in the office and I do a consultation and I hear, I've been to other chiropractors, right away it's almost like a red flag for me because I think, okay, well, what did they do? What did they do before? Chances are it was just pain relief. And you shoot their x-rays, you can see their x-rays, you can see all the degeneration. You have to look at that and you have to own that and say, somebody didn't explain it to them well enough. Somebody didn't tell them just that it's not a luxury. We're not just looking at the symptoms. We've got to look past that and actually look at their health, look at their life, and think, what if I run into that person 5, 10, 20 years from now? I don't want to be that guy that somebody said, oh yeah, I saw you for a couple of times. Now I ended up having back surgery. We've got to do the best we can. We've got to do the best we can. We've got to stick with this. We've got to make sure these problems get corrected. We've got to be able to show them that post x-ray and say, hey, Here's where you were, here's where you are. We managed to get this stabilized. Now, let's keep it stable. Let's make sure that your body doesn't degenerate. Let's make sure you don't end up like my dad.
Hey guys, Dr. Baker here. The question we're answering today is why corrective care? And, in the office, we do corrective care because it works. We're able to do pre-x-rays, post-x-rays to show the results. And I feel that it makes the biggest impact for that patient short-term and long-term. We're able to work on, some of the acute things that they're working on or what they have or experiencing in the moment. But you'll find if we can help them through stabilization of their spine and nervous system and removing subluxation, they're able to get results that are going to last them a lifetime. And that, for me, is making the biggest impact. We don't do it because it's the easiest. We do it because it gets results. So, with corrective care, we tend to help the patient break the old patterns that they came in with, create some new ones. We're able to educate them on how to take care of themselves. We get to get them pain relief. A lot of patients, of course, are going to come in because they have a backache or a headache. And guess what? Chiropractic is really good with reducing, those symptoms. But man, if we can teach somebody, how to take care of their spine and help them to get to a better place and then maintain it and keep it there, man, that's making the biggest impact we can with chiropractic, in my opinion, and as well as with people in our community. So I think with corrective care, we're making the biggest impact. It works, it gets results, and that's all I need. That's all I need to know. Is there the patient that comes in on occasion who just wants that one adjustment? There is all the time, but when you educate them about, why they feel the way they do and that, why this keeps coming back in the same spot every single time, and you show them there's a better way, with great leadership, in a simple and effective explanation, guess what? They get it, and they understand that, hey, let's fix this, not just patch it up. So, I don't know of any better way, and so it's the best way I know, and I'm excited to share it with people, and I'm looking forward to always making that positive difference. So if you have any questions, feel free to reach out. I'm here to help, because I think this is the best way chiropractic can truly make a difference and impact lives and communities. So thank you. Baker out.
All right, let's talk about the differences between corrective care and relief care. So when we started this office, when we started Begin Within Family Wellness, we were a relief care office. And I don't think I knew it at the time. I didn't even know there was a thing called corrective care, so I didn't know that there was a difference. But we operated in a relief care model. And it was very simple. I shouldn't say simple, it was very stressful. But I felt like we were doing like what every chiropractor was doing. We would prescribe 10 to 15 visits, hope that we would get some good relief on a patient, and that they would stay, hoping that they would stay forever because they saw that the benefits that they would stay pain-free. And so it was always based upon how they felt. It was always based on their symptom, which is extremely stressful and extremely hard to pull off 100% of the time. And most of the time you won't pull it off, and you'll end up getting the patient will either leave because they don't get the benefit right away, or they stay for a little bit, they get better, but then ultimately they leave. So we had all these amazing testimonies, but we kind of looked around and we thought, where are all these patients? They're not even here anymore. So long story short is, once we really started understanding why corrective care was so important and why we needed to educate our patients differently about corrective care, it just made me as the doctor a lot more free. One, because I wasn't trying to always just, chase after symptoms, but we were really looking scientifically at the spine and saying, what can we do to take this spine from point A to point B and get it stable? And that's healthcare. That's healthcare, real healthcare. You know, that's getting a spine to go from one functionality to a higher functionality, and the patient overall is a better human being as a result of that. And so we just love the concept. So it's so much easier to educate patients on too. They get it. They really, really understand it. And don't get me wrong, I mean, that relief model still creeps in from time to time. You know, when a patient comes in your office and you don't think they can afford a certain amount or a level of care, but you want to just get them some quick results to see if, you know, they'll stick around. I mean, it still creeps in, but what we've seen over and over and over again is that we end up losing the patient. They never really understand what chiropractic care is. And so in the long run, it hurts us more than it helps us. Yeah, we might get a quick $1,000 or, you know, $2,000 or, you know, whatever it is. But we did the patient such an injustice because they're not getting what they actually need. So now, you know, very, very seldomly, if ever, we do that. And I don't think we ever do it anymore, but that thought maybe still creeps in. So anyway, what I can tell you is that when you transition, and you really transition, one, it frees you up as the doctor, you know, emotionally, that stress, because you're not promising things you can't promise and guarantee. And two, the patient actually gets what they need. So hope this helps. Thanks.
Think about what you just heard. You heard 4 doctors explaining corrective care. And I have to tell you, you know, there's a lot of information in there. And I'm not interested in if anything was said exactly right or wrong, but I can tell you this. I can promise you this, that if that father got relief care for 20, 30, 40, 50 years before he started getting corrective care, that's a big difference in that man's life. And I'll tell you another thing you don't think about. You heard that doctor talk about his dad and his dad's back pain. What you didn't hear is that dad has been fighting prostate cancer for a number of years. That dad that I love as much as if I knew my own dad. That dad who I've embraced and I've hugged, I've gone on adventures with. He's been to my ranch. That dad who together have been, him and I and our families have been at his grandkid's wedding. See, I get that back pain's bad, but I got to tell you something. I believe without a shadow of a doubt that having corrective care all of his life, there's a good chance he wouldn't have had all the prostate problems he has. Let's remember, back pain is subjective and on the outside. Losing the use of your legs, losing the sexual function, losing your bladder control, losing or gaining cancer, that's something much bigger. That's why I reach out so hard and so strong. Because if we had 1,000 pre and post films, and guess what, people? 50% of your post films may not be significantly, noticeably different. But what if we went back, and that's my plan, once we publish the first book with 1,000 pre and post, what if we went back in 10 years and found each of those people, and the ones that were still under maintenance care, we took another picture. So now we have an original, a post, and a 10-year post. See? Think about that just for a minute. An original, a post, post-corrective care, and 10 years of maintenance. Well, I can tell you, I know exactly what you'll find, because I bought a 35-year-old practice 35 years ago from a doctor who took x-rays, put together a care plan, usually 3 times a week for 4 to 6 weeks, 2 times a week for 4 to 6 weeks, 1 time a week for 4 to 6 weeks, and then get checked once a month. And I'll tell you what happened, because I retained over 91% of his patients when I bought that clinic in 1985. Everybody in the next 3 months got a complete re-exam. Everybody in that next 3 months got a complete A to P and lateral C's, T's, and L's. We didn't take full spine back then, weight bearing though. And I'll tell you what, the people who were under his care for over 20 years coming in once a month had the exact same symptoms, the exact same heart problems, the exact same prostate problems, the exact same female problems, and all the other problems as patients who came to me at their same age who'd never been to a chiropractor. See, I think chiropractic relief care is awesome, but I gotta tell you, what if we had, let's take it a step further, next generation. See, some of the chiropractors you'll see, including my oldest son, Dr. Nick Baker. What if we had x-rays, post-corrective care x-rays, post 10 years of maintenance care, and another 10 years? Well, I can tell you, based on my 35 years of looking at x-rays, those people that get checked on a regular maintenance schedule, and quite frankly, I didn't see decay not occur on once a month. So with my technique, we saw everybody once a week, a couple people 2 or 3 times, but almost everybody once a week for maintenance. See, why do I tell you this? Because I want you to realize we may not get this done in my lifetime. And this isn't one more branch of chiropractic. It's just a different study. You know, at one time there were dentists, and then later on there were orthodontists. See, it's not saying one's better than the other. It's just 2 different things. Let's be, if you want to follow me and lead past me, let's imagine what it looks like. Let's just imagine that if everybody was checked by a really focused, specific corrective care chiropractor from womb to tomb, and we had, whether they joined us at 80 or they joined us at 50 or they joined us at 30 or they joined us right out of birth. But what if we had films and I say 10 years, but listen, I'm not a scientist. I'm a clinical scientist. We'll leave this to people much smarter than me. But what if we had that initial set of films? And then we had, if they needed corrective care, at the end of corrective care, we had another set of films. And every 5 to 10 years, we had another set of films. And we watched people. Well, I think what you're going to find is 45 years into practice, 45 years into being a patient, guess what I found? Little to no DJD, where I had massive traumas, bones hitting bones, bones deforming other bones. How come at 60 there's no decay? Well, I believe without a shadow of a doubt, it's because for most of my life, I've been checked once a week since age 15. See? But I'm just one. What if each of us acquired 15 new patients every month, and at least 10 of them stayed for maintenance for 10, 20, 30, 40, 50 years? And we all of a sudden, not all of a sudden, because it may take us 10 years just to get this first book out, but we all of a sudden had pre-films and post, which is the only way objectively you did anything. Okay, my opinion, I'm not against anybody, I'm not for anybody, I'm just stating facts as a 35-year practitioner and somebody who looks over almost 100 offices every single week and have for 20 years. And this August, it'll be 21 years, okay? What if, folks, you want to be on this train, you want to be on this bandwagon of corrective care? I want you to be there. Don't look for what the people before me and the people after me say right or wrong. Just look for the pieces that'll help you serve more people, work less hours, make more money, have more fun. Because scientifically, corrective care is a very interesting proposition. Okay, I've got a few more people I'd like to hear from.
Good afternoon, here's Dr. Andrea from Advanced Chiropractic here in Los Gatos, California. So my take on relief care versus corrective care is that discussion just happened within the heads of us chiropractors. Nobody else really cares and nobody else really knows about it. So here's my take. Relief care, it's like having 2 monkeys sitting on our shoulders, one on the left shoulder, one on the right shoulder. The left monkey, it's getting all excited when a patient comes in and has a really bad headache, a sciatica, and doesn't feel his left toes. That patient gets that specific adjustment, comes back next day, and calls us healer, magician, heroes, and that monkey loves that. It's like food, and we all have been there. I certainly have been there. And then there's a monkey on the right shoulder sitting there and waiting to get attention. And that monkey gets attention when Tom comes in. Tom has severe degeneration in his neck. He needs 7 to 8 months of care. And that monkey starts to talk to us saying, well, you know what, Tom just lost his job because of COVID-19. Are you sure you want to get between $5,000-6,000 from him? Who do you think you are? And you really think you're that good to make that amount of money when other people are suffering right around you? Are you sure? And then we're going to listen to that monkey. And again, I have been there. And both monkeys surprisingly have the same name, and they're both called ego. When we get the ego out of the game, when we leave the ego behind, when we shut it off, when we don't feed them thoughts and we're not listening to them, then that discussion between relief care and corrective care becomes obsolete, because we all know chiropractic is based on the philosophy and the principle of correcting subluxation, and that cannot happen, in 2, 3, or 4 adjustments. Hope that helps. Hope you guys are doing great, and see you guys pretty soon. Bye.
Okay, so I just wanted to let you in a little bit on my mindset of corrective care versus relief care. And to me, it really comes down to 2 different things. The number one thing being, what do you truly want to help people with? Do you really just want to help people with pain relief, or are you wanting to help people stabilize their spine and prevent further future suffering? That's what it comes down to. Which one do you want? And the other thing is, now that goes along with that, is, are you in it just for the now? Like, hey, I just want to help this person out right now, or are you in it for their future and saying, I really don't want to ever see this person get worse than this right now. If we can get them better, great. But let's not let it get any worse than this minute right now, because you know in your heart that if you just let it go and they keep doing the same things, and they already have this degeneration set in their spine, that it's going to just continue getting worse and worse and worse, and you don't want to allow that to happen. And I'm not saying one is better than the other. There's just a distinct difference between the two. And you've got to have that right in your head.
So for me, when I have a patient who asks if we would allow them to come when they want for just relief care or come when they feel like they need it, I always tell them that what I have found and my experience is that 100% of the time people start off with good intentions, that they want to keep coming and they want to see this through and get the problem corrected. But what I found is 100% of the time that doesn't work out. And that I feel like that the patient's health and my reputation is way too valuable for us to allow a patient to come visit by visit or just for temporary relief care. Because what will happen is they'll come in, the patient will feel better, but then if they don't follow it through and correct the problem, thus corrective care, then the problem will come back, whether it's 6 weeks, 6 months, but the problem will come back. And so then the patient now continues this up and down struggle of in pain, out of pain, in pain, out of pain, and never really gets well. And my reputation is tarnished because people are going to ask you, you went to that upper cervical doctor, you went to that Dr. Drury, but you're still in pain. I said, well, it worked for a little while, but the problem came right back. And so that's why we only accept people for corrective care, because we want to make sure that we actually correct the cause of the problem so that the patient doesn't continue to go up and down and constantly fight to stay out of pain. And our reputation, people come, they know that when they come here that they're going to get the problem corrected, so it won't have to live with it and keep battling through this up and down process. Hope that clears up my explanation for corrective care.
Well, I'm Dr. Ingwersen, and I would like to share with you the difference between pain relief chiropractic care and corrective chiropractic care. As chiropractors, we serve patients by directing them with certainty and honesty as to the course of their care and what outcomes they can expect from us. We must know what we can and what we can't do to serve our patients. I can tell you honestly, in all of my years of practice, I have never been able to promise a patient with certainty and honesty that I was going to be able to get them out of pain. Could you really ever promise a patient that or tell them that with certainty and honesty? Would you be telling the truth if you did? However, each and every time with certainty, we can promise a patient that chiropractic care can either prevent, stop, or slow down the degeneration process in their spine, minimizing or preventing further loss of function, and possibly reducing symptoms they have now or will have in the future. A pain relief chiropractor will say that under care, you will feel better. A corrective chiropractor will say it is possible to prevent, slow down, or even prevent future degeneration by stabilizing the subluxation. We know that when a patient is told they will feel better, and they do, they often stop further chiropractic care. In the patient's mind, they reach their goal, they're done. We also know that when a patient is told they will feel better under care and they don't, they stop any future chiropractic care. Why? Because in the patient's mind, the goal was not achieved and chiropractic care didn't work, and possibly they may never visit a chiropractor again. Either way, the patient will never go on to experience the benefits of corrective chiropractic care unless we share the truth right from the onset. Meet Myrna. Myrna came to us on her 74th birthday. She had never had back pain in 74 years. And on the day before, she had her first back pain. She wanted her back popped, she wanted to get better, and she wanted out of there. Without a thorough examination and x-rays, her condition would have gone undiscovered like it had for 74 years prior to this. It easily took 9 months of corrective chiropractic care with my technique for her chronic condition to stabilize. We could hope to stop or at least slow down the degeneration in her spine, minimalizing any future symptoms or loss of function. Focusing on Myrna's pain relief would have prevented her from getting the care that she deserved and needed. Corrective care will maximize the body's ability to self-regulate, giving the very possible best long-term outcomes. Corrective care will aid in building a healthy body and an immune system and reducing any nerve interference, avoiding mechanical decay of the spine, and thus reaching an individual's optimal health potential, especially avoiding needless avoidable suffering. Pain relief will not allow us as doctors to get to the root of a patient's problem, nor is it a service that we can actually guarantee a patient delivery on. For these reasons, I choose corrective care delivered correctly every time.
Well, one thing I can tell you is I love hearing other corrective care doctors explaining corrective care. I'm not looking for anything wrong, just looking for how I could be better. Hopefully you are too. You know, without a shadow of a doubt, I know this. Because I bought a practice in 1985, which I know is probably before a lot of you were born. I bought a practice in 1985 where I worked for an amazing doctor. But that amazing doctor had a tendency to see most of his patients 3 times a week for 4 to 6 weeks, 2 times a week for 4 to 6 weeks, 1 time a week for 4 to 6 weeks, and then hope for once a month maintenance care. And I remember asking him, what are we maintaining? Oh, this is how you keep people healthy. Made sense to me until as a young clinician, I noticed that the people who'd been under his care for 20 plus years and were coming once a month had almost the same symptom picture as the people who'd never been to a chiropractor. So I started x-raying people, which I always found interesting that he x-rayed people at the beginning of care, but he never x-rayed them in the transition to maintenance to determine what maintenance they'd need, nor did he ever x-ray people after that. So when I bought that clinic in 1985, everybody who stayed got x-rayed. And I noticed that the same amount of decay on a 55-year-old man who'd been under this amazing chiropractor's care. 55-year-old man, and whatever the age is, but I specifically remember this one, who'd been under care for over 22 years, getting checked once a month for what he believed was maintenance, had the exact same decay in his spine, the exact same historical symptomatology and had almost the exact same medications for high blood pressure and cholesterol as patients who were 55 years old who never saw a chiropractor. And it really hit me. Are we maintaining what? What are we maintaining? What are we maintaining? If the spine's still decaying, what are we maintaining? And I'm not asking so that you'll call me and break something down about how smart you are and how dumb I am. I'm asking because I re-x-rayed all those people, and I re-x-rayed them every 5 years. And I noticed the people that were getting checked on the maintenance schedule that I was taught, which was once a week. And you couldn't get to maintenance until you did what? Weeks, months, or even years of corrective care so that the spine was functioning, the nervous system was functioning as well as humanly possible. Then we put them on getting checked every week, see? And guess what we saw 5 years into it? 90% of the people had no more decay. 10 still did, but that's a lot different than 100% having decay. And are we in the spine decay business? No, but I got to tell you, it makes more sense to me as a 45-year, I wish I was 45 years old, as a 45-year patient, it makes sense to me at 60 that I have virtually no decay in my spine. My resting pulse is 52 beats per minute. I can still pop off 10 pull-ups on most good days. And I can still run a pretty serious, for me, at 60, 7.5 minute mile. But I can do it for 6 of them. I want you to think about that. So there's genetics, maybe. There's a lot of stubbornness, absolutely. But the one thing I know is when I look at my x-rays, and when my chiropractor looks at my x-rays, there's not hardly any visible decay. On a guy who's had over 400 stitches and 32 broken bones, that's pretty unusual at any age, much less at 60. So I absolutely know there's a lot to relief care, you bet. Sports chiropractic, you bet. Orthopedic chiropractic, you bet. Pediatric chiropractic, you bet. Geriatric chiropractic, you bet. But what I'm talking about today is corrective care, which is why if each and every one of you that jump on this bandwagon do corrective care, and you take that first film and you take that conversion from correction to maintenance, and then every 5 to 10 years you take another standing weight-bearing identical x-ray, I think we can really prove another facet of how amazing what you and I do for a living is. How amazing. I mean, think about it. If you could slow down, if not stop, decay, if you could increase and almost always enhance nerve flow, how valuable would you be? Would your service still be a luxury, or would it now be a necessity? Okay, let's watch a couple more testimonials.
Good day, New Beginnings Docs. We just finished our morning shift here in Santa Monica. We rocked it. It was awesome. It's so nice to see some peeps coming out again. I am happy to discuss relief versus correction. As an LACC grad, I feel very qualified to speak to relief care. My chiropractic experience before chiropractic college was one of correction. 2 years of medical care for an injury that did not get better. Medicine said, we need to fuse your neck and your lower back. I was on meds those whole 2 years and did some PT here and there. I go to a chiropractor, to make a very long story short, and my life transforms on so many different levels I can't even tell you. And so enter chiropractic care into my life, let go of my PhD in neuropsychology, and that's as much as we need to say about my past life. So relief care chiropractic, when I was doing it, I would get to a certain level. People would like me. I got results, I suppose, and they'd feel better. And I did 3 days a week, 2 days a week, once a week. People could accept it. They paid per visit. I billed insurance. My life felt empty and meaningless on a personal level, and I would consider that on nearly 10 years I did that.
I kind of felt lost. Chiropractic was not being performed in my practice the way it was performed with me and on me, and certainly not how I was delivering the goods to my fellow chiropractors in my neighborhood, and them delivering the goods to me. We adjusted each other in a way that we were not taking care of my practice, and it took a little while before that kind of light bulb went off. I'm like, wait a minute, I take care of my family and I take care of myself differently than the rest of the world. What am I doing? I'm seeing 11 people a day, 20 people a day, and that's where it got to. And I felt lost. I felt something was missing. And then, I was reintroduced to the principle. And I remembered what chiropractic is and always has been and always will be, which is the correction and detection, obviously first, of vertebral subluxation, which when that subluxation is putting pressure on our brainstem, on our spinal cord and nerves, reducing the mental impulse, reducing the nerve impulse to the tissue cell, that tissue cell is going to transform into a less than. And there are many professions out there on planet Earth that take care of the feelings of people. I made a decision then and there after my reintroduction that I was going to become a chiropractor and no longer kind of make myself fit into something I thought they wanted. And when I did that, my life and my practice took on a new meaning, and I went from 11 patient visits a day upwards towards 300 a day. 304 was the most I saw in my practice. And miracles happened. People brought their babies. Families started to come. It's like a night and day thing. I chose to become a chiropractor, and in order to do that, I just had to do things in a way that at first I wasn't comfortable with, because I had to let go of some toys and things, and I had to really get honest with myself. And in that process of self-discovery, I realized that chiropractic is what it is, and if I'm going to be a chiropractor, then I'm going to practice chiropractic. And in that process, my consciousness changed, my words changed, my actions transformed, and I lived my life in a congruent manner that consciously or unconsciously the world picked up on, and then people got into airplanes and came and saw me. People would drive across Los Angeles in an hour and a half traffic and came to see me. So ownership of the principle, ownership of the practice, you cannot water it down and expect it not to infiltrate everything we do, everything we are and will be. So relief care, great if that is a direction you want to go in. But if you're not happy, then just go for the uncomfortability and get out of the comfort zone and just become a chiropractor. Move the bone and understand that God will do the healing if that is what is supposed to be for that person. Healing is personal. Healing is between spirit and that particular body. But I know when I deliver the goods with love and the proper intention at the right time in the right direction, I've done the most I can do for that individual. Blessings.
You ever seen a child having an asthma attack? Soon after birth, Josiah suffered weekly from debilitating asthma attacks. He'd be taken to the hospital through the ambulance monthly for emergency treatments, and it went on for over a year. Josiah's mom brought him into our office because their cleaning lady had recommended we investigate and check Josiah. And through corrective chiropractic care, we were able to find areas in his spine and nervous system that were not working properly. And through corrective chiropractic care, we removed subluxations in Josiah's spine. And within 2 weeks, he was done taking medications. Within a month, his parents were done going to the emergency room in an ambulance with their child. Corrective chiropractic care is all about removing nerve interference so that the organs can send signals to the brain. And through corrective chiropractic care, miracles can happen.
So in thinking about the idea of corrective care versus relief care chiropractic, it hit me like a ton of bricks this morning when we had a patient walk in, 68 years old, who's been in pain, low back pain, for the last 7 or 8 years, and now the pain's going down his leg all the way into his foot. He's used chiropractic for the last 7, 8 years, but he's used it from a relief care standpoint to where he'd go 3, 4, 5, 6, 7 times, get adjusted, and start to feel good, and then that was it. And now, as we look at the guy, his disc down at L5S1 is completely shot. His pain is 10 times worse than it's ever been, and we're at a point where we don't know exactly how well we're going to be able to help him. Thinking back 7 years, or even farther if we want to go that way, but at least 7 years, had he known more about the corrective care model, I don't feel like he'd be in this situation today. I'm not saying there's anything wrong with relief care, because it's helped him. It's helped him at least function to this point, off and on here and there, but it's allowed him to actually get worse and worse and worse over time. The biggest issue we have to think about from a corrective standpoint isn't right now, it's 20 years from now. And I think the more people can understand that, the better off we're going to be. Relief care, quick results, get them feeling good, but if we don't actually fix or stabilize what's going on there, 20 years from now, that person could be in a lot worse shape than they could ever even imagine. That's where I feel the corrective care model of chiropractic becomes the most important.
Hey, Dr. Ocon here, and I hope you guys are all doing fantastic. So the question at hand today is relief care versus corrective care. And to me, it's really simple. There's just care. Relief care is just the beginning of care, and corrective care is what we do to finish care. It's not one or the other. You have to do both to be able to make somebody get well. You have to be able to get them out of the pain and help them get out of the pain, and then work through it so that they remain corrected and are able to express health better. It's really a simple deal for me, but it wasn't at the beginning. I've been doing this for almost 30 years now, and I've had and been blessed by some incredible coaches. And I wasn't always a corrective care doctor. I would base my care out of fear on what the patients wanted. It would almost be begging them, no, please don't quit. Please keep coming in. Just come in a few more visits. Oh, you only want 12 visits? We can work with that. We'll do what we can for 12 visits. We'll charge your insurance whatever it thinks they may be able to cover for you. But that wasn't being honest. And I would ultimately not see improvement in a person. And I would get people really upset. And then, of course, chiropractic was the culprit. We were the bad guys because we weren't doing things the right way. When we do care, when we do appropriate, great chiropractic care, we do both relief and corrective. They go together. We have to remember that in the principles of chiropractic, if we go, I think it's principle number 6, is the principle of time. Things take time. Well, I'll take it a step further and say things take time, but they also take repetition. You need to repeat and repeat and repeat over time so that we can help someone get better. That is care. That is appropriate care. That is right care. Now, if you try to divide the two, it's kind of, my father owned gas stations. And when I was a kid, I used to work at them. And to me, when someone would come in and say, I want an oil change, okay, I'd take the drain plug out, I'd let the old bad oil drain out, and then I'd put the drain plug in. And if I just stopped there and said, okay, your job is done, the old oil is out, you can take off, Well, I didn't finish what I was doing, but I'd be saving him money because I wasn't charging for the new oil or oil filter. That is like relief care. You just started something, but you didn't finish it. Now, if I then put new oil in and allow the car to get the new oil and put a new oil filter and allow it to work right, now the car's going to work great and the person's going to be happy. It's going to cost them a little more. It's going to take a little bit more time to complete the job, but the car is going to work. It's not going to break down in 3 or 4 miles. See, it's really that simple to me. It's just a matter of understanding over these almost 30 years of practicing that if I don't cave in to just what the patient wants, rather than being the doctor and directing them with love and passion as to what they really need, that is complete care, which includes relief and corrective care. And to do anything less, to me, is not being a chiropractor, not being a good chiropractor, not doing what's right for the person. You have to have the ability to do both. And you have to be able to follow that relief care up with the directive of correcting the condition. Whether it takes 6 months or 6 years, it doesn't matter. Just be honest with them and tell them what they really need. Look, there's a parable in the Bible that says that Jesus told the disciples, his apostles, let's go out and spread the word. And 2 apostles came back and said, hey, Jesus, we tried doing this. We tried spreading the word. We did the best we could. But you know what? People would slam the doors on our faces and say, hey, this doesn't work for us. And we're having troubles with this. And Jesus' response was, just shake the dust off your sandals and go to the next town. Or some will, some won't. So what? Who's next? That's the question. Who's next? Give people the care they need. Be good about giving them relief and corrective care. Don't divide it and say one or the other. Give them both. Be honest. Tell them how long it's going to take. Tell them how long it's going to take for them to be coming in, and how much it's going to cost, and watch your practice grow. And watch your people become happy, and watch people start referring to you, because people love honesty. Hope you guys have an amazing day. I hope this helps. Bye-bye.
Well, I can tell you this, there's definitely some consistency in dental education, because I was sitting in Dr. Chris's office in 1986, and as I looked up at the ceiling, he had a caricature, if I pronounced that right, of a dentist leaning over a young man's mouth. And the bubble above the young man's mouth said, not that it said, it read, do I have to brush all my teeth? And the caricature, the bubble over the dentist's head said, no, just the ones you want to keep. And so Dr. Rassel's dentist said the same thing. I got to tell you, it made me smile, made me laugh, because every time I think about brushing my teeth, I think about that. And I got to tell you, it's been a long, long, long time since I saw that. All right, so 45 years ago, I was carried out of an emergency room into a chiropractic office. I was held up by patients. Well, they took x-rays of me. I was laid down. I had, pretty stabbing pain in my low back into my left leg, all the way down to the outside of my leg. I had no bladder control, and it didn't appear I had bowel control. And there I sat, waiting for these x-rays. And, I remember Dr. Anderson coming out and telling my grandpa and me, the boy's got a really bad pinched nerve. If we can move that bone, there's a chance his body's going to heal. And that was 45 years ago, this August 13th. 13, my lucky number. Interesting, right? 30 years I practiced, 21 years I've run and helped manage some of you in the top chiropractic offices in the world on one premise, folks, and that is the body is always better with corrective care than without. And I'm not saying corrective care is better than relief care. In fact, I'll tell you this, for the 30 years, maybe not the first 10, but for the last 20 years, if anybody ever said, no, Dr. Baker, I can't afford that care, I don't want to go that long, we said no problem. We referred them to the chiropractor block up the street. And you might say, well, why wouldn't you just help them? Why wouldn't you just give them that one day, that 1 week, that 1 month? And I'll tell you why. And it goes all the way back to the testimony Dr. Drury gave earlier. We got two things, doctors, in our offices. We got that patient's health, and we've got our reputation. And when I say to hundreds and hundreds of people, this is what you need, and over all those years, they said, why didn't my other chiropractors tell me this? I always said the same thing. Your other chiropractors worked in a realm of relief care, and they probably did an amazing job for you. I work in the realm of corrective care, and I don't offer relief care because I know what happens. You feel a little better, you quit, say thank you, buy me a pie or a tie, and then a week, a month, a year later, when somebody says, hey, how was that experience with Dr. Baker? It was great when you're there, but as soon as you quit, it all goes back. See? So the people don't get the care they need, and our reputation gets tarnished. And I have to tell you, I love being a chiropractor. I've loved being a chiropractor since a chiropractor saved my life, at 15 years of age. I love 30 years of practice and coming up on 21 years of coaching the top corrective care officers on the planet, point blank. But I got to tell you, it's because I didn't ever feel it would be okay to give somebody less than what I thought was best to them. If they said, I can't afford it and I just want to get popped, I sent them one block away to an amazing chiropractor who did amazing with relief care with zero guilt. Because I got to tell you, my opinion as a corrective care practitioner, I'd rather not give you any care than give you less than what I know you need. See? And it goes right back to what Dr. Drury said. We've got that patient's health and our reputation. See, nobody leaves your office. See, they come to you for pain, the pain goes away, they go away. They come to you for pain, the pain doesn't go away as quick or as good as they thought, they still go away. So you have an entire patient base of people who went away. And when they go away, they don't say great things about our profession. I'm with you, Dr. Drury. That patient's health and my reputation are far more important than me ever giving somebody 1, 2, 3, 4, 5 adjustments, knowing full well they're going to run around and badmouth our glorious profession. Folks, if this makes sense to you, and obviously this is going to New Beginnings doctors, but if you New Beginnings doctors want to push this forward to other doctors who you think would be interested in corrective care, push it forward to them. I'm not interested in emails about what I said wrong or what I said terrible. I'm not interested. I'm interested in people who want to help with this study. I'm interested in people who want to look at all the pieces, but I keep bringing up the most objective ones we have. Pre, post, and continual films showing actual objective findings on a weight-bearing spine tied in with a little history. See? It's not going to happen in my lifetime, but I sure hope the book with 1,000 pre and posts gets done in the next 6 months. Why? Because if each and every one of you listening to this just got off your asses just a little bit more and sent me 3 to 5, that's it. 3 to 5 pre and post films. And if they're amazingly different, that's great. If they're no different, that's great. If they're worse, that's great. We're not looking to skew the study. We're looking for real science here. And a little story. Jon came in, 40 years of chiropractic. Jon went through a 12-month corrective care process, pre and post. And then 5 years later, and here's his 5-year, and here's his 10. Let's stop just being different, folks. Let's love on each other. Let's help every chiropractor no matter what they do. If the chiropractor next to you does relief care and bills insurance and never collects a dollar, that's a great chiropractor to have next to you. If the chiropractor on the other side of you does pediatrics only, that's a great chiropractor to have next to you. If you've got 10 chiropractors in your town that do corrective care, that's even better because now we're forming a normal. But don't you ever, ever, ever bag on anybody else in our glorious profession. If you don't have something good to say, don't say nothing. All right. Corrective care, here we come. Next level. all your pre and post films to Baker for the study. We get 1,000 pre and post with a little short paragraph. We publish the book, and we introduce our profession to a little more longevity, a little more positivity, and we start creating a next level positive thought for what we're capable of doing. But we never, ever, ever, ever talk bad about another human being in our profession, preferably on our planet. Okay, Baker out. God bless.